Right. Welcome to the Precision Protocol series brought to you by Biocanic. In this series, we nerd out on the world of personalized health, functional medicine, clinical research, and cutting edge wellness strategies. We explore the advanced science, clinical applications, and real world impact of precision protocols designed to optimize client outcomes. Be sure to subscribe wherever you're watching and listening so you never miss an episode. And for those of you uh, joining us live, we'll move into a Q&A, but feel free to post your questions as long as you go. We'll pull those questions on if something really gets you excited about what we're going to talk about today. I'm Jeremy Malecha, CEO and co-founder of Biocanic, and I'm joined by my amazing co-host, Brendan Vermeire. And today we're going to be talking with our guest, Awais Spall, and we're going to be talking about peptides. So welcome and thanks for joining us. How are you doing, buddy?
I'm doing great. It's great to be here.
It's great to have
Awesome.
you with us, man.
Yeah. So maybe just to kick it off, maybe some people have seen you on our other live streams, talking about your own health journey, but we brought you on to talk about peptides. So maybe focus in on kind of what you've been doing, just to give people a little bit of background on why you're the peptide expert we want to talk to.
Fantastic. Okay. So my journey with peptides starts around 2010, early 2011. I graduated high school and I developed a series of complex muscle disorders. I was diagnosed with myofascial pain syndrome, regional pain syndrome, myalgia, fibromyalgia. They were just like coming up with new diagnoses. Stiff person syndrome was considered. I was like, okay, that's it. This is a bunch of nonsense. They were diagnosing me with all these things and just prescribing painkillers. And I wanted to live a full adult life, and I felt like really depressed. So I started looking outside of conventional medicine. I found a lot of different alternative providers. Eventually, I find this provider who is using, platelet-rich plasma at the time, and he starts giving me some treatments, and I'm like, this is helping a lot. A lot of the spasms and cramps are calming down, but like I'm just not getting there. So then he says, I want to introduce you to a NBA treatment. I can't name which athlete this was that he was working with, but he wanted to give me that level, like what he was giving this person. And I was like, okay, well, what are you giving this quote unquote athlete? And he said peptides. And I was like, what the heck are peptides? I've never heard of this. And this is 2011, right? So this is 15 years ago. And he goes to his printer and he prints out a bunch of stuff. And at that time, there just wasn't a lot available in the US and there weren't a lot of resources. And he's like, I'm telling you, this is the future of medicine. And he put me on a peptide protocol, and it was absolutely life changing for me. It was so restorative to my system. And since then, I've just been blown away with peptides. So I was a very, very early adopter. And sort of in my clinical work, I've been educating for many years now in the US and to clinics across the world, and running different protocols, tracking sort of what's efficacious, what's working, whether we're talking about immune, whether we're talking about building, whether we're talking about, trimming down or other metabolic goals that people may have.
Awesome. And I guess maybe just to level set for those that are new to peptides, what is a peptide? And, everybody's familiar with supplements and medications. Where does a peptide fit in? And, why is it called a peptide?
Amazing. So peptides are these tiny chains of amino acids. They're signaling molecules that, signal various things in the body. And, you can have peptides for various different things. You have thousands of peptides working in your body right now. You have peptides in your brain. You have peptides all across your tissues. You have peptides even in your bones. So they're doing all these tremendous things. They're considered biologics because they are biologically occurring in your body. And yeah, they're just these tremendous signaling kind of molecules. And what they're most known for is the class known as anti-inflammatory peptides that reduce inflammation. Again, they're naturally occurring. So when people take them, they feel like they took like an NSAID or something even stronger, and get this systemic sort of anti-inflammatory effect.
Awesome. And then, just maybe quickly touch on, with the most common name brand that of peptides that you can't seem to escape today. And then we'll dive down into the rabbit hole on kind of what's being used in longevity and regenerative medicine.
Yeah, absolutely. So just talking through the different category, like what's most popular.
Yeah.
Fantastic. Yeah.
AKA GLP-1.
Yeah, right. Okay. I'm a slim guy, so I forget that GLP-1s are the most popular peptides, you know. Um, so yes, GLPs are kind of, I guess, the reason peptides have come into the popularity that they have, because they are peptides. They do occur in your body. So the first one that sort of came out, and they'd actually been around for a while. GLP drugs and GLP mechanisms have been researched for a while, but Ozempic comes around the scene a few years ago, and that's semaglutide, and that is working on GLP pathways, modulating insulin. It's modulating various sort of metabolic signaling. And as people start taking it, they start realizing, okay, well, this helps you curb appetite. This helps modulate insulin. So they're losing weight, and it's reducing certain inflammatory pathways. So it's reducing inflammation in the body. Then people start realizing, wait a second, I can microdose a GLP for various anti-inflammatory purposes. Then comes out the next class, which is GLP plus GIP. And now we have the third class, which is GLP plus glucagon, which is a little bit more muscle sparing with all the same types of sort of metabolic regulation with the GLP and the GIP. And essentially, it's working through a few different pathways to sort of modulate insulin and to improve metabolic signaling. And why people like that is it helps you just burn fat. And with retatrutide in particular, it helps make your metabolism more efficient.
Awesome. All right. So now let's start to kind of walk into a little bit of the deeper end. So, personally, I did the BPC 157, which is very well known in our industry. I did the Wolverine stack with TB 500. So maybe kind of start with kind of those foundational peptides, just as kind of where they've, the more significant applications of what we've kind of seen over the last couple years within our industry, and then we'll kind of take it in from there.
Yeah, absolutely. So, BPC is one of it's the most popular peptide for a reason. It's the Swiss Army knife. It's not just working on inflammation. It's also working on quite a few different pathways. It's working on quite a few immune pathways. I've seen some incredible, remarkable stories about this. It's a pentacopeptide that's found in gastric juice, but on top of being found in gastric juice, it's also sort of found in different tissues, and it has various overlapping pathways. VEGF is a key pathway that it works on. It's sort of this master repair signal in the body, and it sort of upregulates the body's own angiogenic cytoprotective cascades. I remember I was at this GI training. Gosh, this must have been like 8 years ago now, and you see this before and after picture of a Crohn's disease patient that was dying, and he was like 155 pounds, like a 6'5" dude, like a big bone dude, and he's just like thin and frail. And then 3 months later, he's like fully back to health and jacked. And the clinician that was teaching this course said that one of the key tools he used was BPC 157. And I've seen many, many remarkable sort of stories like that. I've seen people, have an injury, take BPC 157 and recover 30% faster, 20% faster, right? Sometimes even a little bit more than that, like 35 to 40% faster. And you just feel better. Sometimes it feels like it's able to get into some nagging pains. Like, someone has some nagging elbow pain that they've had for years, and it just doesn't seem to go away. They do a 2-month cycle of BPC, and they're like, wait a second, this is starting to go away, right? So it's fantastic in its anti-inflammatory potential. Then you have like TB 500 or thymosin beta 4, And that is working on actin, and it's working on healing fibrous tissue in the body. And it's also anti-fibrinogenic as well, which we know is really important for that healing cascade. This has been around bodybuilding circles for a long time. Even, as when I was like very early in the peptide world in the 2010s, I remember I would go on forums and bodybuilders would be describing like, yeah, I tore my pec and I injected an entire vial of TB500 into it, and I was back in the gym in 1 month. Just like extreme stories like that. So bodybuilders have loved this. It's fascinating because it's the first letter is thymosin, right? Thymosin beta, and we know the thymus gland, which is like right around where I'm pointing, and that's like the master immune gland of the body. So we know that the immune system is a part of these repair cascades in the body.
It's funny. Hearing your comment about the bodybuilding world, which is kind of a little bit my background. In my early 20s, I was a competitive bodybuilder, and so that was where I first got exposed to peptides, because within that world and all the different performance enhancing substances people are using, of course, they're all using foundational supplements and creatine multi, or at least I sure hope those big guys are. But, of course, they're loading up on like grams of androgens and pretty much as much growth hormone. And I never did any of those hardcore drugs, because I very quickly realized to be successful in that sport, like that's just part of it. And I didn't want to do all that. But looking at some of the stacks that they would do, as much growth hormone as they can afford, like not just 10 IUs, but 20 IUs, 30 IUs, whereas like a longevity dose might be like 1 to 2 IUs daily, right? But the research chemicals and the peptides, those were kind of these like, adjunctive things that you could sprinkle into some of those cycles that those guys are doing, back in the T Nation days. So to your point, like back then I would have never anticipated that peptides would blow up the way they are now, but I do. I think the GLP-1 GIP, which, those, to your point, that's nothing new either. And so kind of is hitting this like mass precipice, like right here, right now, which is really interesting. And I think the research and the regulatory shifts that are going on right now are really, really exciting. But I guess what I was trying to highlight there is, there are a lot of demographics such as the bodybuilders and performance enhancers that have been, experimenting with these compounds for, many years now. So despite maybe we lack some of the like placebo-controlled studies to really prove effect size and kind of, separate signal from noise, so to speak, but the anecdotes, are obviously very pronounced. So, I'd love to hear a little bit about, because I think you're seeing real people in the real world that are on, some of these protocols. I'd be curious what, some of the combinations and protocols, like Jeremy mentioned, the Wolverine stack, which is kind of one of the more, popular ones of some of those combinations that people are having great success with.
Yeah, absolutely. Yeah, absolutely. I forget you have
bro science
that background. Yeah. Well, no, the science background. You are. I was very scientifically prepared for this, knowing Brandon's here. But the bodybuilding side, I forget that. You just look like a bodybuilder day in and day out. So I forget you actually had background in that. So the stacks that are kind of popular and effective, I would say number one is that Wolverine stack. Everyone has some kind of nagging thing in the body that could use some extra love and support. And oftentimes when we just do some deeper repair, we find that other body systems can kind of work better, right? Like I've seen some people that have like adenoids that are very swollen, and they'll do BPC. And even though it's not really working on any direct pathway, like tissue pathway, they'll find that their swelling kind of goes down because general systemic kind of inflammation has gone down. And obviously for joint protocols, post-surgery protocols, post-injury protocols, right? The BPC TB500 is incredible. Now what's all the rage is what's called CLO or CLOW, and that's BPC 157, TB500, this melanocorticoid peptide, KPV, and GHKCU, which is a copper peptide, and they're all done together to make this like massive like healing kind of synergy between those 4 peptides, and that will, it just reduces inflammation and it'll promote healing, and it'll even people that'll do that for 2 months will notice that their skin is just glowing, and they're just looking vibrant and feeling amazing too. And yeah, so Clow or Clo has become really, really popular. The next ones are that I've seen sort of in my work, and as I mentioned, I've trained a few clinics across the world, and they'll have a lot more data than we can because a lot of places in the world will have adopted peptides a lot more. And what I've seen is the growth hormone peptides are, and Brandon, you're an OG, so it's like it's so interesting. Like, yeah, I remember those discussions around GH. I would follow, even though I've been like one of the skinniest dudes in the game. Like, I've actually been following bodybuilding for a long time and even studying like the anabolic stacks. Right, I was fascinated with that biochemistry as early as like my early teen years, and like I remember when 20 IUs of growth hormone sort of became acceptable for bodybuilders, and they would get those like big old bubble guts, right?
Mhm.
And it was like, okay, well, 20 IUs can push you past this plateau and into this, this hyperplasia, this growth of new muscle cells. But the trade-off is going to be that belly, right? That you're going to have. So like when I remember, and growth hormone peptides were the first peptides that I did back in 2011, and they they worked incredibly well for me back then. I was very, very young, and kind of as they started becoming popular again over the past few years, I was like, are they really that amazing in comparison to like actual growth hormone, like HGH, somatotropin? And it's like, no, they are. Like, people feel incredible on them. One of these clinics that had hundreds of patients that I was kind of training and overseeing, it was just like men would do a tesamorelin, ipamorelin, CJC cycle, and just it's not even that they put on so much size, but it's the way that their brain felt. They would get jacked, their performance would go up in the gym, maybe lean mass would go up like 2-3 pounds. I didn't watch it be as anabolic as people might think that it is, but the performance that people would get in the gym and the mental performance, just you would take a guy off of it after 3 months, and they would be like constantly asking, when can I go back? When can I go back? It's just, they feel really, really good on it. Then a third sort of class that types of protocols are immune system protocols. This goes into some of the politics around it, right? So I'm glad Jeremy gave us the green light to talk about everything, right? Because thymosin alpha 1 2020, it's it's incredible, and it's just doing a lot for people, what do you call it, that are going through COVID. So, and there's even studies that's looking, human trials with thymosin alpha 1, right? Because thymosin alpha 1 was being used for hepatitis, it was being used in HIV context, and it's just this master immune modulator, right? Not to be reductionist, but like it's the seesaw of the immune system that we see in autoimmunity and cytokine storm, right? Like COVID was an example of this like cytokine storm. Ebola is an example of cytokine storm, where the immune system will just destroy so many functions and things in the body, right? Autoimmunity, in the most simplest sense, is high immune sort of output where you don't want it, low immune output where you'd want immune output, like microbes and stuff. So TA1 just perfectly modulates that. My personal experience with it was during, I'd used it before COVID, but during COVID, I got Delta. Like, if y'all remember when, Delta just dropped, and that was a hot strain at that time. So I had to get it. So I got the Delta strain. I was wrecked. I was super duper sick. And It was like 2 weeks, and I'm like, okay, I'm not getting better. What's going on? Everybody was like, oh, that's normal with this. And I'm like, this is not acceptable for me. I feel like horrendous. I got some TA1, did it, and I was like, holy moly. It was like 1 to 2 days. I spoke to one of my naturopath doctor friends, and she was like, I have patients always that are on this, on TA1. They are bedridden, and in 3 to 4 days, they're powerlifting again. And I'm like, I believe it, because that's how I felt. It was almost like I forgot that I was, feeling so bad the day before. And I could just, thinking about the biochemistry of what's happening in my body. So then what happens? And I started thinking, okay, thymosin alpha 1, it's doing a lot for people that are, experiencing really severe COVID reactions. And this could be like a miracle molecule. What happens? The FDA and regulatory bodies come in and they regulate thymosin alpha 1. You can't compound it anymore. It's being used off label, all this stuff, right? Of course it is, right? As soon as it's kind of saving lives and whatnot. But yeah, so TA1 is sometimes used with KPV, sometimes used with another sort of bioregulator version called thymolin, and there's other sorts of different types of peptides that work on the immune system, but that's a whole other sort of class.
Awesome. Just want to get to a couple questions. Mona Bala and Hunt Valley Chiropractic. So I think Mona, we kind of touched on the immune support for Hashimoto's, but there's obviously the question around kind of the best delivery mechanism, right? So you've got injection, you've got, oral tablets, you've got transdermal, you've got nasal sprays. Maybe kind of just talk through the pros and cons. What's the best approach? How do you think about it when you're training the other clinics?
Gotcha. Okay. So I don't want to piss off my Russian colleagues. Peptides came from Russia, right? All the research and everything. And I have a lot of, colleagues that are researchers right now in that world. They love the orals. I personally, in my own practice, in my own work, as I've like trained clinics, as I've done clinical roundtables with clinicians that I've been working with, oral and injectable, I have not found orals to be as helpful as subcutaneous injections. There's so many, again, I'm going to piss off a lot of companies that they're all my friends and I love all of them, that are making sort of pro-drug vehicles, which is like liposomes, other sorts of ways we would encapsulate, like in gel or something, to get it to reach the GI tract, absorb slowly, right? There's all sorts of mechanisms that we've come up with for that, and there's many like pro-drug vehicles and versions of encapsulation. And then there's also like this microneedling thing where you put the peptide on and then you like stamp it with a needle, like a series of needles, and it goes in. And I'm like, people are trying to do all these things. I'm like, just freaking, it's a subcutaneous injection, right?
Mm-hmm.
Like, the microneedling I find to be fascinating, because it's like you're gonna hit it with like 10 smaller needles, like just hit it with one, sub-Q insulin pin, right? So I find the best bioavailability to be sub-Q injections. That being said, oral still works, and there's some that are only available orally, right? Like the neuropeptide dihexa is only available in oral capsules. And along with 5-amino-1-MQ, which is a metabolic peptide. But yeah, that's in a nutshell. My approach is usually sub-Q injection.
Yeah, and one kind of comment on that, like when I was preparing for a shoulder injury, I was told to do sub-Q in belly fat, and then I was at A4M, and the regenerative doc was like, "No, dude, the whole it goes to where it's needed thing doesn't really work. You gotta inject it at the injury site." And I actually saw a step change in that. But love to hear kind of your comments on, this idea that it'll go wherever the inflammation is, or does it need to be near where you want to have the most effect?
Yeah, and this is where I love the beauty of sort of clinical knowledge and clinical knowledge transfer, right? Like we shouldn't be like doing the craziest stuff to ourselves, like the way bodybuilders were, right? Like, let's see what happens if I inject myself with 30 IUs of growth hormone, right? But that being said, like in our clinical ecosystems, we discover sort of knowledge and we share knowledge and we learn what works and doesn't work. So it's been really fun for me to see these kind of trends, and myself, I've like switched sides on this. So for this question, local or systemic, right? You have TB500 BPC. Should you inject them locally if you have a shoulder injury, or does it even matter? Should you just inject them into the belly and just have them systemically kind of circulate? Initially, very early, it used to be local, go local. Then we had a period, I remember, in the clinical like discourse, like 2018 to like 29, like end of 2019, 2020, where it was like, no, it's systemic. You guys are like, thinking that it's going to go there, but it's like the circulation is systemic, so just go systemic. But then it's like in that time period, a lot of clinics since then, when they've had patients and clients do local, people just report better results. So I do think local makes a lot of sense, even though, we don't have like the studies on this, or we don't even know exactly what the mechanisms might be for something like that, but it just kind of makes sense. Like the peptides are closer to the injury site, so to me, local makes a lot of sense.
Yeah. Last comment before I hand it over to Brendan. One of the things that was recommended was doing the injections and then DMSO. Any thoughts on that?
Yeah, so you're using DMSO as sort of a as a penetration enhancer. Yeah, many clinics are doing that. There's other types of acids and acetates that they'll use to enhance penetration. Again, I didn't find that big of a difference with DMSO being used versus without DMSO. But if some clinics have some experience with that, I think, I think that could make a lot of sense. What I did find to be like more effective than that was using, and this is gets a little more technicals, and not every clinic has the capacity to do this, but to do an injection and then use something like a class 3, class 4 laser, or some type of like therapeutic red light, like a near infrared or red light on that site. And that seems to have a very synergistic effect with the peptides in driving them deeper into the local tissue.
Awesome.
That's super fascinating. How do you feel about because we were talking off air, and for the audience might be helpful because there's like boots on the ground, real world. You're observing real people on these peptides and anecdotally observing their responses and trying to document, because it's such an interesting subject. We're kind of in this like our technology surpasses our understanding, and in some ways it's ironic because like with my sort of like bro science background, if you will, like to make a case for bro science, I guess, like there's and validate anecdote is actually what I'm getting at here. Because I mean, real world experimentation matters, right? Like I think about the beginning of my career as like a trainer and nutrition coach, and competing in bodybuilding. And it's like, we knew what works in the real world because we're the ones doing it and getting those results. And, like with exercise of now, here we are like 20 years later, and we have the strong research to prove that what we were already doing back then, works. And exercise is one of the most powerful forms of intervention. So I think we're kind of in that stage right now where it's like we have this massive hype and interest with peptides and in so much promise, but then we are lacking and far behind with the research, which, to be fair, like research is by nature always catching up with the natural world and how biology is working. And so like even yesterday I was doing a deep dive into thymosin beta 4 to make some educational content. And, that one in particular actually has some pretty strong human data, including like phase 2 and phase 3 clinical trials. But that was more for eye health as like eye drops or like a topical kind of thing. Whereas then I couldn't find any data for like a subcutaneous, right? But I would be curious because I know one of the the big challenges with like the metabolism and the half-life. Some of these peptides are thought to, only have a half-life of like 30 minutes or up to like 2.5 hours or something. So I'd be curious, are you seeing a lot of clinicians doing like multiple doses throughout the day, whether that's like multiple subcutaneous injections or multiple oral? Do you think there might be, I guess in my head, I kind of think of it of like, how much of this peptide can we kind of pump through the body like per day to like achieve the result? But I'm curious what you're seeing, in the real world here.
Yeah, absolutely. So I'm going to say a word right now that's going to excite some listeners and it's going to lose some other listeners.
Sure.
And that is pharmacokinetics, right?
Yeah.
So with the pharmacokinetics of peptides, in a nutshell, they're mostly pretty fragile, right? So they're broken down by proteases into constituent amino acids. They don't bioaccumulate. There's also like a receptor saturation ceiling. So it's not like small molecules that can overwhelm like enzymatic systems. Like there's a natural down regulation with receptor based signaling. Like if I gave you 10 milligrams of BPC or 20 milligrams of BPC, and the one sort of very, very small trial that was recently done on BPC involved like 20 milligrams at a time. So yeah, that's kind of what we see. Like it'll do amazing things, and we're just like, but then but we have these like kind of safeguards. So this is a really just awesome question regarding like the pharmacokinetics and like the half-lives and what are the best dosing mechanisms for these, right? Like what's the best way to take certain peptides? Is it better to do 4 250 microgram injections of BPC in a day, or to do one, single milligram injection per day for a repair protocol, for example? So to answer this question, again, I go towards what are the clinicians seeing in the real world, and then we kind of can infer science from there. That's like, I think like the way it kind of often works, as you described with the bodybuilding work and kind of, the quote unquote use of the term bro science, is that like, it's that process of inference through that experience. So again, way back when like in like 2017, like 2018, when there's a few pharmacies prescribing some peptides, we used to think, I remember there was some discussion around breaking apart dosing for some of those repair peptides to that like level, like 250 milligrams, like twice a day. We just started seeing better results when people just did 1 milligram. And I could be very biased here. This is the data that I have access to and I've seen. And that's where I've seen a lot of just protocols recommended by different doctors and experts just move towards that. And maybe it's because we get this like that spike is important, right? That spike is more important than sort of like continuous saturation, tissue saturation, right? Like a difference would be, we're talking about peptides and not like conventional pharmacology here, but in like different fungal drugs, like some fat soluble fungal drugs like intraconazole that a lot of people in the mold world use, right? Like you want to dose that sometimes throughout the day because you want that longer half-life. I have not found that to be super important for subcutaneous, injection of peptides or even oral. I've seen the best data when we just create like a full dose, like once a day rather than a few small peaks and troughs. And similarly, second experience I'll share with thymosin alpha-1 was, I remember when it was originally being recommended by compounding pharmacies, the pharmacist would kind of recommend like 200 like micrograms a day. Then we started seeing that, well, what if as we like increase the dose, what happens inside the body? And one of the things that we would notice is it's kind of working as an anti-fibrinogen. It's sort of improving circulation. So then we're getting in that broad spectrum of effects, we're getting some other effects that have more benefits when we do sometimes this bigger dose. And then, during COVID, people were there. There was a doctor in San Jose that was, Matt Cook, who was recommending that people that like had to get the vaccines. He just shared a story. They were doing like a high dose of thymosin alpha 1 before and after getting the shot, and it would help with certain physiologic like reactions that they would that they were experiencing. And the same thing when people would get like immediately get COVID, doing a high dose of thymosin alpha 1 would be very, very helpful, more than doing like a few smaller doses. So it's still protocol dependent, because there are unique situations in which I will prefer the pharmacokinetics of smaller dosing with higher frequency.
It's interesting. I'll be really curious to see how, when we have more data, like, something like BPC that's severely lacking human data, whereas like the thymosin beta 4, they've done some IV trials, pumping like really high doses through an IV, which that to me, because where my mind goes, like, obviously we've got, longevity performance optimization, but I also think about the people that are really compromised with like complex chronic illness, chronic Lyme mold, the post-COVID autoimmune fibromyalgia, whatever's going on with some of those people that, need more passive care. They're not healthy enough and able enough to do active care and do the workouts and whatnot. So I'm always very sensitive and empathetic to that demographic of like, if we can just give you things that give you the spark and get your body to a better place, so that we can get you moving again, so that we can get you back in the gym. And so the idea of like, if we could, hook somebody up to an IV and, pump them full of a Wolverine stack, because like the studies I was looking at yesterday was that where, I know one of the studies, it was like an IV of thymosin beta 4, like at high doses with really no observed negative reaction. So that's one that I feel is confident or, safer at higher doses. But, doing that IV, like, every single day for a week straight, for example. But I really like what you were kind of postulating there around, is it maybe better to have a spike of, like blood saturation to get like a better signaling effect? Because I do wonder about essentially like receptor density downregulation, which seems to happen with like, hypersaturating testosterone, or I even think, the GLP-1, the tirzepatide and Ozempic and all those, I think there is probably something to be said for like oversaturating the receptor, where then you could get like a blunting effect. So I'm just kind of thinking out loud, but I don't know.
Yeah, I think that's a fascinating kind of discussion, and I gotta tell you, you're not someone who does bro science. You are science, Brendan.
Hey, thanks,
man. You happen to participate in bro life, which I do too, but you are science. So
a little self-deprecation helps,
Yeah. So the receptor downregulation, and this is just like explorations that me and you do in sort of thinking about these biochemical sort of cascades, right? And these like pathway charts. And sometimes we, with testosterone, you get that downregulation. With growth hormone, we don't see those negative feedback loops when someone takes, growth hormone. Even I've seen bodybuilders come off 20 IUs a day. We still don't see negative feedback loops. Are they, healthy after doing that with these giant guts and their heads are now like, twice as big after all? No, I'm not saying that, but I'm not observing a negative feedback loop. Now with, when we influence something downstream, can we influence the upstream sort of pathways? I think sometimes that does happen in biochemistry. You kind of, as you're saturating those receptors, you can influence upstream sort of physiology. But I think what I have sort of seen is what ends up happening, and the main peptides that this will be observed in is growth hormone peptides like ceramorelin, CJC, tesamorelin, ipamorelin. where it's not necessarily that you have like receptor saturation leading to downregulation and negative feedback loops. We don't really observe that. It's just more so that there's almost like the body is just kind of saying, no, you know what, like we're done after 3 months. And that'll start with like some very mild immune responses, like a tiny little red dot near the injection site will start after, like, for some people it's 4 months, for some people it's like 9 months. We don't observe that. And I'm sure you know bodybuilders and people that have been on HGH for years, and they don't really observe that same pattern. But with the GH peptides, they do. I haven't really observed that with other ones, but I think it just points towards the fact that these things should be pulsatile. And the other part of that is sometimes it's not that there's a plateauing or a receptor downregulation, but your body is just like, I would, do BPC and it helped me through various health issues that I had early on. But then there came a time where I was like, I don't notice anything anymore with this. Whereas I would like consistently notice, it's still doing things. I've just had a perception plateau per se. And then I would pause for like 3 months, do it again. Then I'd be like, okay, I think I'm done here. This has done kind of what it needs to do. And now I don't like need to do anymore. So I think it's honoring just, the pulsatile nature of biochemistry.
Yeah, I'd agree with that. I think that it overlaps a lot. Like HRT, we could kind of loop in this conversation. And I will say something I'm observing, and not that I am in any way trying to promote what some of those extreme bodybuilders, do. But I mean, because there was a time when I was 21, I wanted to be Mr. Olympia. I wanted to be, that monster on stage. And then when I started getting an idea of what it takes to actually get that big, I was like, okay, I don't want that. But it does, even still to this day, I kind of follow some of those pages and whatnot, just because like it is truly mind blowing that the human body is even capable of that. And so, not that I'm saying this to justify, the average person dabbling with something that they may or may not feel comfortable with, but you look at the extreme bodybuilder, that's the most extreme example where they are probably not being responsible. They are, dosing much harsher compounds at these extreme levels, whereas to me, what gets me so excited about peptides, I think these could be this beautiful class in between like your small molecule pharmaceuticals versus like natural supplements that are great and work naturally with your body, but like very modest effect size. Whereas I hope to see in time, we can establish some pretty impressive peptide effect sizes, right? I mean, trying to establish efficacy in general, but I mean, even like the growth hormones, secretagogues, and the GLP, GIP, obviously, I just think there's so much potential. But I did want to ask, because the other week I had put up a post about Semax, and somebody commented, like a follower from Russia, and she's like, we have that as a nasal spray in like every pharmacy on the corner of Russia here, which I thought was interesting. I'm curious, like with some of your Russian colleagues, because some of that OG research that came out of Russia with like the Slank and Semax and some of those peptides.
Yeah, absolutely. It's super interesting, like across Europe, especially Russia, but across Europe, the way different peptides are used. Like it's not a peptide, it's a sort of family of peptides, or it's a little soup of peptides called cerebrolysin, which is essentially just pig brain extracted like growth factors and peptide molecules. So it's like this beautiful symposium of just brain molecules with a lot of peptides. And there's like, I had a friend that was just traveling across Europe, and he was saying that in many parts of Eastern Europe, so you go into a pharmacy and you can just buy cerebrolysin, and just over the counter, and people will use it for headaches and energy and also all sorts of reasons, right? Whereas here, there's so much allure around cerebrolysin. It's this like, it's so hard to get. And I did a cycle of cerebrolysin a few years ago, and it felt like to me, it felt like the limitless drug. I just felt like my brain was so sharp. I was doing this guided meditation, and I'd done that guided meditation many times. And I did that right after doing a cerebral license shot. And it was like I was hearing the guy for the first time, and it changed like my relationship, it felt, to words and symbols and the way my brain organizes symbols. So I could feel how neuroplastic it was. And I'm like, I just kind of laughed when a friend told me that, oh yeah, it's just available everywhere over the counter. Whereas like people are like doing crazy stuff to access this. And yeah, so Cmax and C-Lank, have been around, since it in like were discovered in Moscow in the 1980s, and they've been around, for a long time. They're pretty bioavailable nasally. We know that a lot of like nasal compounds have the ability to cross the blood-brain barrier very easily, and Cmax and C-Lank seem to work very, very well. Cmax tends to work a little bit more for focus. C-Lank tends to be a little bit anti-anxiolytic. But I think that these kind of labels are not always all that helpful, because sometimes I would think that I need something that's going to help me focus, but I would take C-Lank and it would take that edge off and just kind of reduce that like kind of intensity, it would feel like, and I'd be able to focus really well. And then the combination of them works really well. Sometimes it's just one works better than the other, but yeah, those two are really awesome.
Mm-hmm. Man, I feel like the sky's the limit here, because like, especially with the nature of research, a lot of times it's like, well, let's first try to figure out if this thing is good for this condition. But I mean, because of the like pleiotropic signaling effects of, especially when you start mixing all these things together, I get really excited. But I do want to, there were a few questions in the comments I noticed, kind of around like adverse effects in general, which the only one that I've really seen, and even then it's theoretical based on like mechanistic plausibility, but like, okay, thymosin beta 4 upregulates angiogenesis. Could that then contribute to like tumor growth, right? We don't know, but I haven't, at least through combing through the research, I haven't seen much of anything as far as adverse effects, although we're grossly lacking a lot of human research. But have you seen any, are there any like contraindications or any adverse effects with any specific, peptides or stacks that you're seeing? And then the other question that'll stack on there, pun intended, is mixing different peptides in like the same, insulin syringe. That was another question I saw come through.
Yeah, absolutely. So to start with adverse effects and the big question around cancer, oncology, angiogenesis, I did a peptide event last weekend in San Francisco, and one of my colleagues, Dr. Elena Maria, she's wonderful. She brought this discussion up. Somebody asked this question, and she introduced a word, angiomodulatory. And in the research, we're finding this word being used a little bit more, because angiogenic, you want, with like BPC, you want angiogenesis in certain places, right? It's more so if someone has like an active cancerous tumor, we don't want them to be taking like BPC or TB500 or anything that could be angiogenic, right? But this word becomes like misused and often like manipulated. And in San Francisco, the discussion we had was around, well, some of these molecules are angiomodulatory, meaning actually in certain environments, there's some research and some data to indicate that they could actually be anti-cancer by reducing inflammation, by cleaning up certain cellular pathways. And I think that this almost goes towards the politics of, the old like women's initiative and the kind of demonization of bioidentical hormone replacement, and hormones cause cancer, right? Like these things. Oh, if a growth hormone causes cancer, I think it's a very good like little snippet that people get stuck inside their head, and then they're like, oh yeah, no, I'm staying away from that, right? But it's like, actually, it's a lot more complicated, like the research around angiogenesis, what it takes to kind of get that growth. But absolutely, if somebody has like an active cancer in their body, we wouldn't want that. That wouldn't be appropriate. Then safety from there, like, what have I actually like seen? I feel like there's plenty of literature out there people can explore, but what have I seen over the years? So two people were hospitalized at RadFest injecting peptides, and that kind of brought it into the news, like the dangers of injecting peptides. I'm not going to say too much about that in, what happened there, because I know some physicians that were there and people did some risky stuff. But oftentimes what happens is people don't know, how to reconstitute. They're not cleaning their skin appropriately before injecting. They're not being hygienic and aseptic with it. They don't know how to reconstitute the peptide. They're not under guidance. I haven't even seen problems if people like dose too high, like, oh my God, something crazy is going to happen. Like if someone took 10 times the dose of acetaminophen, that would be a big problem. I have not seen, I have seen people like, oh shoot, I took too much of this, except for VIP, vasoactive intestinal peptide. That's one where you take too much and you'll have a flush. But again, it's just, I haven't seen anything where it's like some kind of like crazy, side effect or some crazy effect that happens to someone, as long as they're following like those things and under guidance. And also the case, if you have like a chronic health condition and you're just kind of like self-experimenting for treatment, and if you have a chronic health challenge, like an autoimmune thing or like mold or Lyme, you're already sensitive to taking things. So you should definitely be under guidance for the right protocols. But that's a situation where someone will feel funky or get a histamine reaction to certain peptides because they have, a complex form of a pretty advanced form of mast cell activation, and they're already reactive to so many things, and they'll react like pretty harshly sometimes and get like a little rash. Again, I haven't seen anything like too crazy. And then also with growth hormone, I already mentioned that, but like sometimes people after 9 months, the body needs a break and people will get like little red bumps.
Yeah, I think that was really well said. Definitely brought up a lot of thoughts in general of how, people can be quick to demonize things, but then it's like in reality, I think there's much, worse things that are going on. Like, I mean, don't even get me going on like alcohol in general, but that's a different thing for a different day. But what was I just going to say? With the angiogenesis, I mean, you could also like exercise promotes angiogenesis, sunlight promotes angiogenesis. So to like just directly blame a mechanism that is implicated in something like cancer, I think angiomodulatory is probably a much appropriate way to phrase it.
Absolutely. So, and then I don't want to forget, someone asked the question around mixing peptides. So just very, very quickly, without getting into, I'll just share what I've seen, because I could answer this with just we could get into pathway chemistry, and that's just a can of worms. And people say, the biochemistry should be kept independent, inject them separately, and the science can point towards both ways. But what I've seen is, some people, classically BPC and TB500 would come in the same vial and people would inject those together. I personally kind of like them separate. And like with the Clow stack, sometimes I like it together for someone, but sometimes depending on the protocol, I want to dose things differently, and we want to modulate the doses, right? There's a science to the titration of it. So I often do like them being separate for that reason, but I do still find bioavailability when they're together.
Awesome. One practitioner, which I'd be curious to, the sourcing becomes like the main question, right? Any guidance on, sourcing reputable sources, what to look for. And then kind of a part 2 on that, we have a FDN graduate, go FDN, asking about, how could an unlicensed practitioner, a functional health coach, help to facilitate, shall we say, peptide therapy?
Yeah, absolutely. That's a fantastic question, and a tricky one. So regarding sourcing, there is obviously right now the FDA has sort of declassified peptides from the risky category. Well, they're going to, right? They've declared that they're gonna vote to do so, and it's expected that they will be removed from that risky category and they'll be compounded again. And these are like the most popular peptides. It's still like not everything, and there's a lot that's not going to be on that list. So a lot of physicians will be able to prescribe peptides again. Overall, it's considered a huge win because it adds them back into, legitimacy. I can't kind of disclose this too much as of yet, but I've been a scientist and I've been a part of the peptide space for a while. So I've been a part of a few different clinical distributions. People are welcome to reach out to me, and I'm happy to kind of connect them. And I've ran the certificates of analysis myself and gone pretty deep and worked with some incredible scientists on how are peptides even made? How do we test rigorously for quality and making sure that we have a good product? So I'm happy to connect clinicians. Now, unlicensed practitioners, how can they work with this? That gets kind of tricky because it's like, and I'm not an attorney. So it's because technically, even as we consult and do our health services outside of a licensed world, we're kind of doing so often under the guise of education, and we use other frameworks in our terms of service and things like that. So oftentimes I know many practitioners that are not licensed that are FDN adjacent that have no problem with it. They've lumped it into that. The main kind of, I'm not going to answer the legal side of it, but the main thing is that you can it's something that a lot of people right now want, right? And a lot of people, they're gonna do it regardless, right? So guidance is not a bad thing. So and for this FDN or other FDNs, you're welcome to, I have a school community, you're welcome to join, and I can, I guide through this process. It's free right now, the school community. So I'm happy to kind of provide support and kind of resources.
Awesome.
All right. Well, maybe as a last segue for the last couple of minutes, you want to just kind of give your contact info, tell people what you're working on, and then we'll make sure to get that information in the comments on the replay.
Absolutely. Yeah. So, my Instagram is integrative, integrative medicine, and Oasis, Oasis of the desert. So integrative Oasis, that's it. So that's my Instagram. And, if you can send me a DM and I'll send you an invite to my school community if that's, of interest. And I've also been, working with this incredible team, and we've kind of built this amazing app, and I wanted to build a platform where we can share resources, where we can kind of have a database of every peptide that's out there. What are the standard dosage protocols? What does the data say? What's the safety profile? What's the mechanisms of action? So we've built that, and with a reconstitution calculator that even kind of supports you in understanding how to reconstitute and guiding through that process A to Z. We have a lot of clinicians using that app, and they will send their clients protocols through the app. So we're refining that ecosystem. There's protocols on there. We beta tested it for a few months on people that know nothing, and wanted to learn. And then we would ask them, like, you know, and it's a really, really great tool. And again, it's free right now at the time of this recording. So that's just the Peptide app, and you can find that on the App Store. And you're welcome to, we have a Discord community for that as well, where there's different practitioners sharing, you know, experiences and stuff. And that's like for the app community. But yeah.
Yeah. Well, this has been an awesome discussion. We had a lot of great comments. Although we didn't pull up the exact comment, it was kind of funny because through the conversation, you ended up answering most of those questions around profile stacking, safety profile sourcing. So really appreciate having on. This was a really great conversation.
Yeah, awesome, guys. You know, thank you to both of you. This was a lot of fun.
Oh, absolutely, man. I think you're the guy to come back on and we'll talk about psychedelics sometime.
Ooh,
Continue that conversation we started at
okay.
Paleo FX in 2019.
Wow, man, you sure you're not on cerebral lysin, dude? Your memory's like out of this world, man. Yeah.
Oh no, I just care about you so much that I remember our last
man.
in-person conversation.
That's so sweet of you. I also track our conversations from 2019, then 2025, IMMH, you know.
That's right.
4:53 p.m. It was a 4-minute conversation. Yeah.
Awesome.
I need to get that peptide.
Yeah.
Well, awesome. All right. Well, thanks everybody. Thanks everybody who joined us live. If you watch this as a replay, post it in the comments. We'll make sure to get those questions over to Awais. So always appreciative. And thanks everybody.
See you guys.
See you guys.